benefited more from my NCLEX prep than I did in nursing school.
No way.
So these 10 topics literally are lifesavers, y'all. So if you're watching, you better get your notes ready and stay tuned. Okay, so topic number 1, priority and delegation. What do you give to a nurse? What do you give to a LPN? What do you give to a UAP? You need to learn the differences, okay? I have a couple of resources in my Etsy shop that will help you with this. It's under the HESI bundle, or the NCLEX bundle is under both of those. All right. So you need to understand also too, what patients do you see first? Okay. This is when you utilize the ABC method. Okay. Topic number 2, infection control and isolation precautions. Okay. This is the contact, droplet, and airborne. Okay. You need to understand which PPE do you put on first, which PPE do you take off first. All right. Please understand this, y'all, because I had a lot of questions over this. All right, number 3 is therapeutic communication, okay? You need to know how to talk to your patients, okay? They are not your homegirl and your homeboy, okay? You need to know what not to say. So during these answer choices, go through each one and seriously sit there and think, okay? Some of them may be obvious, and some of them you may have a tie between 2 of them. You need to understand that the answer choice that is truly correct is the one where you're asking questions and telling them to tell you more about the situation or more about the issue. You want the patient to give you more details before you come to a conclusion on something. So just keep that in mind when you're doing your answers. Okay, number 4. I have to look at my notes. Number 4, lab values and critical ranges, okay? I'm going to write your notes down. I hope you got your notes because this is about to get crazy. So the lab values that you truly need to know for an adult are potassium, sodium, their BUN, creatinine, and glucose. Those are the main ones you need to understand, y'all. Because you need to understand, when do you worry about a patient? Now, they're not going to ask you straight up, like, okay, what's the range for potassium? They're not going to ask you that. They're going to be like, which patient should you see first? There's going to be a patient that has hypokalemia. There's going to be a patient that has breathing problems or something like that. You need to understand, okay, is this potassium? Is this in the right range? Or are they breathing correctly? Or, stuff like that, just to know which ones to worry about first, okay? And also, too, that goes back into my ABCs, airway, breathing, and circulation. Which ones do we need to see first? So a lot of these test questions have priority and delegation questions. So please hone down on those type of questions, y'all. But lab values and critical ranges, I'm going to say it again. You need to understand potassium, sodium, BUN, creatinine, and glucose. And you need to know when to worry. And to be honest, you need to know if they have too much of this, what do you need to give them? Okay, so for my Google Notes, I have OB emergencies as 5, but I personally did not have a lot of OB questions, which is really crazy to me because I feel like I would have aced that the first time. But we're just going to talk about it anyway. So like late D cells and prolapse cord, like what do you do? Typically, it's important to ask for help, y'all, but also to you need to make sure that you understand why these things are happening. So like late D cells. I'll probably put a little acronym here above my head. It's called VILCHOP. I'll probably go into it in a different video, but just understand that late decelerations are because placental insufficiency. Okay, and if there's a prolapse cord, you need to call for help because you're running back to the OR. Okay, and then it says priority interventions, y'all. Priority interventions for OB emergencies are more so turning the patient, giving fluid boluses, stuff like that, and make sure not to call the doctor. Okay. Ooh, y'all. So option 6. Option 6 is about psych nursing, okay? You need to understand what you are expected to do or say during suicide precautions. A lot of this is questions about what you should say to them if they have thought about hurting themselves or someone else, or what you should do. Also, too, this is about restraint rules, okay? We talked about restraints briefly in nursing school, and to be honest, you need to understand, like, how long should restraints be on? What are the different restraints? Is it a chemical? Is it a physical? Those type of different things, okay? You won't get a lot of questions about it, but it is important to know about, okay? Ooh. I keep saying ooh, but number 7 is pediatric milestones. I had a lot of questions about this, and I don't understand why. Pediatric milestones. So what should a 1-year-old be doing? What will happen at a 6-month-old or a 6-month-old? What will happen at 18 months? You need to understand those milestones. Briefly look over those, y'all, or do some practice questions on it, because it will be on the test for sure. It says red flags. So if a baby's not doing this, or okay, I won't say that. Think of it as, what should a baby be doing at this age? What should a baby be doing at that age? Okay, that way you can know what the red flags are, which is basically the opposite of that. If they're not doing that, it's a problem. Don't study too hard on this, just because some of these things most likely you would know off the rip, but just do a little couple practice questions, and if you get majority of them right, move on to the next little slide. Okay, number 8 is electrolyte imbalances. The main ones that we typically see are hypo and hyperkalemia. You need to understand what you should be giving your patients and what to assess first and what symptoms of toxicity do you see. I'm pretty sure when I'm saying this, you're probably already generating some answers in your head, which is great, but just do some more practice questions because those case studies, y'all, can really get to you, okay? So hypokalemia, hyperkalemia. What are the symptoms? What are the ranges? What do you need to do first? What do you need to assess first? All right, think of that, okay? Oh, y'all, we really getting into it. Okay, we're almost done. Got 2 more. So number 9 is medications you should know. When I tell y'all these medications, you need to look them up. You need to understand what they are, why we're giving them, and if we give too much, what happens, okay? Are you ready? Because I'm ready. Okay, so the first one, digoxin. Y'all, make sure, before I even get into too deep into this, make sure you understand both names of the medications, okay? We say digoxin, but what other name is there? Okay? We say lithium, but what other name is there? We say heparin, what other name is there? Also, too, like I said, you need to know the side effects, the antidotes, signs of toxicity, all those other things. Why are we giving it? You need to understand. So, like I said, digoxin, lithium, and heparin. All right? Learn those, y'all, and practice those questions because I'm telling you, if you get those right and you keep getting other ones right, baby, you're going to pass. Okay? You're going to pass. Okay, last but not least, yes, we're done. Last but not least is safety and fall precautions. We talk about this so much in nursing school that is basically embedded in our head. It is nice to still do practice questions, y'all, but safety and fall precautions, like, come on, y'all. Come on. So this is about the call light, the bed alarms. This can also go into restraints as well, too, because you need to know, like, do you need a sitter? Do they not need a sitter? Also, environmental hazards, making sure that the bed is in the lowest position, that their call light is near, that their bedside table is near, that the room is clutter-free. There's easy walkway in and out in case of an emergency. Those are very specific and important questions. Also, too, I'm not sure if they test about this, but like making sure that there is fall like wristbands or like little flyers around their room to ensure them, one, to call you, but also to let other people know, like, hey, this is a fall precaution patient. They need not to be getting up by themselves. Okay? All right. So I hope you took notes. All 10 of those you need to know. Okay? So you need to be practicing that because I need you to be a nurse so you can come help me on this OB unit because everybody's having babies out here and I'm tired. I love what I do, but I'm tired, y'all. But seriously, though. I also have pre-made NCLEX notes. So if you feel like this is too much and you're feeling overwhelmed, literally go to my Etsy shop. There's 50% off all month of April of 2025 on these notes that you need, okay? You don't need a promo code or anything. Just go to the Etsy shop and click add to cart and check out. These notes are pre-made. All you have to do is just look over these notes. There are some practice questions in there too. I think there's over like 50 pages of practice questions. It's very important for you. Okay, so Etsy shop, link down below. If you have comments, questions, concerns, down below. Okay, don't forget to like it, share it with your friends because we need to pass the NCLEX, y'all, the first time. Okay, and we keep giving NCLEX all our monies. And I don't know about you, but I was really furious about that. So let's pass the first time, guys. Okay, let's get this together because you can do this. We're giving you so much information, so many resources out there. It can be overwhelming. It can. But we're just here to help you guys and help you through it. All right. So this is Nurse T out. I will see you guys next time. Let me know if you need a specific video and I will get it to you. Okay. All right. Bye for now.